Well, hello everybody. I'm Dr. Robert Buda, the Lifestyle Doctor. Today we're going to be talking about cholesterol lowering medication, or statin drugs as they're commonly known. So, if you've ever had a blood test before and it's come up as you having high cholesterol, it's extremely likely that your doctor has recommended that you go on cholesterol lowering medication, or statins. Statins will lower your cholesterol, sure. They will actually make your cholesterol marker come up lower than what you originally had. Now, the question is, are they really safe and effective? Firstly, statins have made a huge amount of money for pharmaceutical companies. In 2005 alone, it was a $26 billion industry. That's right, I said billion with a B, not million, billion. Now, here's what happens is that people often get put on these drugs and are told that they will be on them for the rest of their life. Can you see why this might be such a good revenue generator for the pharmaceutical industry? If you're on a drug for the rest of your life, it's a very, very good thing. Now, why would you take cholesterol lowering medication in the first place? The reason why people do it and the reason why doctors recommend it is because high cholesterol is associated with heart disease and then death by cardiovascular disease. So if we can lower the cholesterol level, then it stands to reason that we should be lowering the amount of deaths by heart disease or cardiovascular disease. Sadly, this isn't true. On huge studies done where people who were otherwise healthy but had high cholesterol and were put on high cholesterol lowering medication or statin drugs, they were shown to have no effect on the mortality rate or the risk of death. The risk of death did not change, in fact. In fact, the only group of people that the risk of death actually went down on was people who already had existing high-risk cardiovascular disease or congestive heart disease. So if you're healthy or otherwise healthy with a high cholesterol marker, then you probably don't want to be on statin drugs. Here's the kicker though. For the people that it did actually help and did actually reduce their mortality rate or their risk of death, aspirin has been shown to actually be as effective and 20 times cheaper and have less side effects. So, really the bottom line is this. If you are on statin drugs, if you have been put on them because your cholesterol was too high, you really ought to be thinking really hard about whether you want to stay on them. Because are they really giving you the benefit that you think you're getting from them? And the cost involved, of course, needs to be evaluated. If you are on them because you've already had heart disease, maybe you want to think about aspirin as a different drug to be taking there. But in that case, I would consult with your doctor and have a really good conversation about that. As usual, this is Dr. Robert Buda, the Lifestyle Doctor. Have a fantastic day, everyone.